Which vaccine leaves permanent scar mark in children? A. Measles. B. Pentavalent. C. DPT. D. BCG. And the correct answer is D. BCG. About 2 to 6 weeks after the vaccination, a small spot may appear at the site of injection. It is normally turned into a blister, which is sometimes oozes before becoming a crusty scab. Leave the vaccinated area uncovered as the air will help it to heal. It is normal to leave a permanent scar mark on the vaccinated area. One of the most appropriate measure for storage of DPT vaccine is A. Should be kept in refrigerator. B. Should be frozen. C. Should be used immediately. D. Should be used at room temperature. And the correct answer is A. Should be kept in refrigerator. DPT vaccines should not be frozen, but it should be kept in refrigerator between 2 to 8 degrees centigrade temperature. It will lose potency if kept at room temperature over a long period of time and if frozen. Temperature required to store BCG vaccine is A. Below 2 degrees centigrade. B. 2 to 8 degrees centigrade. C. 8 to 10 degrees centigrade. D. Above 10 degrees centigrade. And the correct answer is B. 2 to 8 degrees centigrade. Except polio and measles, all vaccines are stored at 2 to 8 degrees centigrade temperature. It is strongly advised that cold chain should be maintained until the vaccine is administered. What is the ideal storage temperature for the polio vaccine? A. Minus 20 degrees centigrade. B. Minus 10 degrees centigrade. C. Minus 5 degrees centigrade. D. Minus 15 degrees centigrade. And the correct answer is A. Minus 20 degrees centigrade. Polio vaccine is known to retain its potency over the long period of time if stored at minus 20 degrees centigrade or below. Vaccines lose their potency if exposed to temperature above 8 degrees centigrade or if kept in freezer. A. TT, DPT and DT. B. TT, DPT and polio. C. TT, DPT, polio and BCG. D. TT, DPT, polio and measles. And the correct answer is A. TT, DPT and DT. Almost all vaccines lose their potency if exposed to temperature above 8 degrees centigrade for long period. Vaccines also lose potency if kept in freezer except polio and measles. Reverse cold chain is used for A. Carrying stool sample of polio patient from PSC to laboratory. B. Carrying outdated vaccine from PSC to the district hospital. C. Carrying vaccine to the laboratory to check its potency. D. Carrying the vaccine from camp to subcenter. And the correct answer is A. Carrying stool sample of polio patient from PSC to laboratory. Stool specimen of AFB, that is acute flaccid paralysis, have to be sealed in container and stored immediately between 2 to 8 degrees centigrade in cold box to shift laboratory immediately, because prolonged exposure to heat on the way may destroy the polio virus. It is called reversed cold chain. What is the dose of BCG vaccine at birth? A. 0.1 ml. B. 0.05 ml. C. 5 ml. D. 2 ml. And the correct answer is B. 0.05 ml. Dose of BCG vaccine at birth is 0.05 ml. The BCG vaccine is given to newborn babies at risk of getting tuberculosis. Unused BCG vaccines should be discarded after A. 2 hours. B. 4 hours. C. 6 hours. D. At the end of day. And the correct answer is C. 6 hours. BCG, measles and Japanese encephalitis vaccines should not be used beyond 6 hours of reconstitution under any circumstances. The diluent used for reconstitute of BCG vaccine is A. Normal saline, B. Glycerin, C. Dextrose, D. Distilled water. And the correct answer is A. Normal saline. Normal saline is the recommended diluent for the BCG vaccine. The reconstitute vaccine should be used up to 6 hours and after 6 hours it should be discarded. What is the site for BCG vaccination? A. Left thigh, B. Left deltoid, C. Right thigh, D. Right deltoid. And the correct answer is B. Left deltoid. The BCG vaccine is injected intradermally into the left upper arm at deltoid region. The correct dose of BCG vaccine is 0.05 ml at birth. Which of the following syringe is used for BCG vaccination? A. 2 cc, B. 5 cc, C. Tuberculin, D. 10 cc. And the correct answer is C. Tuberculin. The dose of BCG vaccine is very small, only 0.05 ml. In order to measure and inject such a small dose accurately, you must use 0.5 ml tuberculin syringe. BCG vaccine given to protect child against A. Diphtheria, B. Tetanus, C. Typhoid, D. Tuberculosis. And the correct answer is D. Tuberculosis. The BCG vaccine protects against tuberculosis, which is known as TB. TB is a very serious infection disease that can cause TB meningitis in children. What should be done with Frozen DPT vaccine? A. Shake thoroughly before use. B. Should be melt before use. C. Discarded. D. Brought to room temperature before use. And the correct answer is C. Discarded. All vaccines lose potency if kept in freezer except polio and measles vaccine. Any other than polio and measles vaccine that is frozen solid should be discarded immediately. Measles vaccine is kept in refrigerator in A. Chilled tray, B. Freezer, C. Tray below the freezer, D. Shelf in the door of refrigerator. And the correct answer is B. Freezer.